Welcome back into the nest for more intimate chats with the lovebirds. Now, with more discussion about love, sex, and relationships, here are Drs. Chuck and Joanne Bird.
Welcome back to our Friday evening, our second hour here, Intimate Chats with the Lovebirds, and we are talking with Dr. Dietza Katz and Dr. Ross Tabasel of the Women's Therapy Center in Plainview, New York, and we were just talking about what vaginismus is. Welcome back.
Thank you. Here we are.
Yes. And you were saying, both of you, about what vaginismus was and how so often, and we've heard this before too, and it's so sad, just have a glass of wine, just relax. Everything will be okay.
We had a psychiatrist once who told a patient to just smoke pot.
Oh, great.
Oh, my gosh.
Great.
The medical pot to smoke. Yep.
Take a pill, take some Xanax. Wow.
Would help.
Wow. How prevalent is it?
It's hard to come by because vaginismus is such a shameful condition. Women live with it in silence. They don't tend to talk about it. They think they're the only one. They think they're deformed. They don't talk about it to their doctors for the most part. The medical community does not usually ask about these things. There's some improvement in this area now, but still not widely spread. So it's hard to come by with the exact prevalence of it.
Yeah.
But it's out there, and it's big.
Yes, and how old are the people usually that you're at least seeing up in your center?
They can vary anywhere from we have 17-year-olds all the way up to we had someone who was 85.
Really? Wow.
It can vary.
Well,
Wow.
that's great that 85-year-old
Are thinking about this and saying, you know what,
that's
I want to deal with this. Exactly.
Well, you know, with the onset now of Viagra, I mean, Viagra, the women need to be able to use their vaginas a lot longer.
Exactly. That's right. That's right. And how is it typically diagnosed? I know they're coming into their doctor. They're saying it's painful. I'm not able to have any penetration. Or a lot of times they're saying we're not able to have kids.
If they do.
Yeah.
Yeah.
If they don't, it is quite common to go to an infertility clinic and be already enrolled in assisted reproduction without even being asked, was there a penis in vagina?
Wow.
Oh, my gosh.
So it's not properly diagnosed. But vaginismus, because it's so simple a condition in essence, is most often self-diagnosed. The woman may not know the name, the term, may not know that there are other women like her, but she knows nothing goes in there. Or she knows she's scared, and even if she could do a tampon, she may not be able to do the other penetrations, and intercourse is always on the suffering end of it. So it's mostly self-diagnosed.
Right, and also they're not able to many times even go for a gynecological exam.
Correct.
Oh, absolutely. Or they go and the doctor will use a pediatric speculum or do a blind swipe and tell them, okay, I did the exam.
And that's it.
And that's it, but they really didn't get a good exam, and that's a shame.
Oh, wow. And that's why I think what you guys are doing is fantastic. How did you guys come up with, or tell us about the body-mind treatment approach that you guys have pioneered, because I think it's fantastic.
It is.
Well, because we took a fresh look at vaginismus from the integrated point of view of it being a somatic disorder, a situation where the body speaks for the mind, and through the stress centers of the body, as we mentioned before. So we were just, at the beginning, as like any other artist, we're fumbling around. Let's see how we can come up with a good approach for that. And lo and behold, we develop our approach of gradual vaginal training, penetration training, with specific, very specialized anxiety management done combined.
And what
it's
we're
really like addressing the somatic disorder here.
And you said the gradual vaginal training. Can you describe what that is?
Yeah, because the problem has to do with difficulties with vaginal penetration. Then you have to train the vagina to accept penetration in the normal speed, tempo, with things that typically go inside, as you mentioned in the introduction: finger, tampon, gyno exam, various dilators from small to the size of a penis, to really get the area used to it, the mind saying, oh, you know what, it's really not so bad. I can really deal with that. And then to manage the anxiety about it. It's done best simultaneously instead of fragmented I'll talk about it to my mental health clinician, and then I'll just hold my breath and try and relax and see how I do at the gynecologist office or with my partner in bed.
And exactly. And so
Right.
many clinicians will say, okay, here's this dilator set. Now I want you to go home and I want you to progressively insert each
Use
one.
these, and you're like, whoa.
And of course the woman is going, what?
That's exactly
And
it.
we have a collection of dilator sets that patients have brought to us that have never been used.
Of course.
Because they really, they really just don't know what to do with them. And there are patients who just can't use them. But we want to say there are some who can. Some with mild vaginismus who really just need that little push.
Right.
Can go home and try it and say, oh, this worked.
But again, if they
After
haven't...
they've tried, I'm sorry, go ahead.
No, go ahead, please.
After they've tried it for a little while, meaning a month or so, if they haven't been able to cure themselves, then they need more help than what the dilators are giving them.
Absolutely. They need more intensive work.
Yes, absolutely.
More, not only intensive, they need more guided professional help.
Right.
Well, sure, I can imagine. You're taking those things home. That would scare the crap out
Especially
of me.
if it is a fear response.
Yes.
Yes.
Again, that
Yeah.
anticipation like you were talking about when they're looking at the last size and going, what? What do they want me to do with this? No way I'm going to do this homework assignment.
Even with the lesser size, understand that the woman who has already the panic about putting something in, and don't forget, the vagina, unlike the penis, which is external and visible, the vagina is internal and invisible.
Right.
So right away with it, go the feeling, what is it? Will I break something? Will I hurt something? If I feel something, just the basic sensation of penetration, maybe it's bad, maybe it's not just getting used to. There are a lot of question marks, and it's very hard to be your own cheerleader and your own guide when you yourself are so nervous about the activity.
Exactly. What is normal? What am I supposed to be feeling down there when you talk about down
And
there?
many women have heard that if I have a hymen, what am I going to do? Am I going to bleed? Is it going to hurt so badly? Because I've heard that this is the worst pain in the world.
Right.
True,
Exactly.
True.